Welcome to another season of the Aced It podcast, where we turn science into sense. In this season, we are introducing you, our listeners, to some of the Justice Community Opioid Innovation Network, or JCOIN, family. In episodes 1 and 10, you will hear from our funder, the National Institute on Drug Abuse. And in episodes 2 through 9, you will learn about cutting-edge and recent science published by some of the investigators working in the Learning to Advance Practice, or LEAP, program, a part of JCOIN. This is so exciting. So let's get started. I'm Danielle Rudes, your host, and this is Aced It. This week, we're going to discuss something important to all of us: sleep. I know, I've also heard it time and time again from my doctor, how important sleep is. But did you know that more than a third of adults in the United States don't get enough sleep? According to the CDC, or the Center for Disease Control, the recommended amount of sleep for adults is at least 7 hours per night. But with balancing work, family, and social events, sometimes it's hard to get enough. When people are having a hard time getting enough sleep, they will often try to find ways to help them fall asleep and stay asleep. For some folks, reading a book or having a cup of herbal tea before bed helps. However, other research has shown that some people use both legal and illegal drugs to help them sleep. So let's talk about that today. What's the relationship between drug use and sleep? Luckily, there are researchers studying exactly this. One team doing this work includes Drs. Tess Drozdowski, Wendy Cleaver, and Misha Marzel. The lead author on the paper we're talking about is Dr. Drozdowski, who works at Chestnut Health Systems. Her research focuses on how to get young people with substance use and mental health symptoms linked up with evidence-based practices. In 2021, Dr. Drozdowski and her team published a paper entitled "College Students Using Marijuana to Sleep Relates to Frequency, Problematic Use, and Sleep Problems." This study looks at how college students, a group of people who often really struggle to get enough sleep, use marijuana to help themselves sleep. But the authors are interested in a bit more than just that. They're also interested in knowing how using marijuana to help sleep predicts marijuana use, problematic use, and how well people sleep. And they wanted to know, does any of this depend on sex or gender or race and ethnicity? To understand this question, the team surveyed 841 college students in Introduction to Psychology classes. However, the sample for this study only consists of 354 students. These are the students who reported using marijuana in the last year. Most of the sample were around 19 years old and identified as female and white. The authors asked students several questions to understand their marijuana use and sleep quality. Then the authors analyzed the data using a bunch of fancy statistical tests. The first analysis explored if using marijuana to sleep was related to marijuana use and problematic use. The second analysis explored if using marijuana to sleep was related to sleep quality. The third analysis explored if sleep problems are related to marijuana use frequency and problematic use. The researchers first used a very basic statistical analysis to look at sex and race differences in marijuana use, using marijuana as a sleep aid, and sleep problems. From this, they learned that men report using marijuana more frequently and had more problematic use when compared to women. Men also had an easier time sleeping throughout the night than women did. Also, compared to non-white students, white students used marijuana more frequently and slept for longer. All right, now for the results of the fancier statistical analysis that I talked about earlier. This one analyzes the data in a lot more detail. First, let's look at whether using marijuana to sleep was related to marijuana use and problematic use. The findings showed that college students' use of marijuana to sleep was associated with more frequent and more problematic marijuana use in both the past month and year. There were no sex or race differences here. When looking at the second analysis, exploring if using marijuana to sleep was related to sleep quality, Drozdowski and colleagues found that marijuana being used to sleep was associated with difficulty getting a full night's sleep. There were no sex or race differences in this model either. Finally, the third analysis, which explored if sleep problems are related to marijuana use, frequency, and problematic use, found that sleep problems are linked to marijuana use and problematic use. In fact, daytime dysfunction, which is a person's inability to function during the day, was linked to both marijuana use and problematic use. There were also no sex or race differences in this model. The take-home message here is that based on this research, college students seem to be in a losing battle when trying to solve sleep problems with marijuana use. Specifically, when students' sleep is disrupted, they may sometimes turn to marijuana to help them sleep, but in doing so, actually decrease their sleep quality. And although there were some differences in marijuana use and sleep patterns between men and women and white and non-white people, gender and race does not impact the effect of marijuana on sleep quality or the relationship between getting poor sleep and using marijuana. This study adds to what is known about marijuana use and sleep quality, especially among young adults, and disrupts common misperceptions about this topic. Rather than using marijuana as a sleep aid, Drozdowski and colleagues suggest that healthcare providers should ask students about their marijuana use, as well as life stressors, coping, and emotional regulation patterns. This is because, as we just talked about, students using marijuana to sleep experience more sleep problems rather than fewer. The authors also suggest the use of screening tools, such as CAGE, C-A-G-E, and then the AID stands for Adapted to Include Drugs, which can quickly and effectively gather information on substance use, facilitating initial conversations between healthcare providers and patients about their habits and potential issues. An important takeaway here is that since this study found that using marijuana to sleep can lead to more sleep problems, we need education to counter the belief that marijuana improves all aspects of sleep. This could help patients understand the potential negative impacts of using marijuana as a sleep aid. As an alternative, cognitive behavioral therapy for insomnia, CBT-I, was highlighted by the authors as an effective treatment option. The American College of Physicians recommends CBT-I as it has no serious contradictions and is more effective than prescription medication for improving sleep in both short and long-term follow-ups. Finally, Drozdowski and colleagues note that the research on the relationship between sleep and marijuana use is still developing. Given the complexity of the marijuana plant, with its different strains and modes of ingestion, further research is needed to develop more accurate and appropriate clinical guidelines. We all need sleep, but some of us go without it more than others. When people find it difficult to sleep, they may try different avenues to try to obtain it, whether that be through a cup of tea, staying away from blue light, or maybe reading a book. The study I reported on today dives into how college students using marijuana to sleep relates to frequency, problematic use, and sleep problems. Hey, that's the title of the article after all. Walking away from this episode today, I hope we have all learned that marijuana use does not actually enhance sleep. It does the opposite and actually decreases sleep quality. Kind of not what we're going for. Thank you for listening to the ACEIT podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Opioid Innovation Network, JCOIN, their coordination and translation center funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters on this season, Sam Houston State University doctoral students Alexa Mata and Bryce Kushmerek-McCune. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their amazing production. Tune in again soon for another episode of Aced It.